Welcome to animatedteeth.com and our page that discusses factors that need to be considered when making a decision about what to do with a wisdom tooth that has developed tooth decay. As you're probably aware, it's relatively commonplace for a person to have their wisdom teeth extracted. So, when you have a third molar that has a cavity, doesn't it make sense to just go ahead and have it pulled? Well, that may make the best plan for many cases, but it's not the best one for all. And as an explanation, the remainder of this video will outline factors your dentist will need to evaluate before coming to a conclusion about how to advise you. To start, we'll mention that just because a tooth is a wisdom tooth doesn't mean that it's not a valuable member of your dentition and should be saved if possible. Yes, the diminutive size or oddball shape of some third molars may render them functionally useless. As can poor positioning, like the case where the tooth only pokes part way through your gums. But those circumstances certainly don't exist with all wisdom teeth, and many might be missed immediately if extracted, or might have played an important role in rebuilding your mouth in the future if adjacent teeth are damaged or lost. So, your dentist must weigh the importance of your tooth both in terms of the role it plays now and how it might be useful in the future. And, generally, and especially in the case where the needed repair is just a simple filling, a dentist will typically be inclined to encourage you to keep any tooth possible. In deciding to save your tooth, an important factor that must be examined is why it developed decay in the first place. Was it simply due to lax oral home care? Wisdom teeth are positioned in the very rear of your mouth where they're hard to see and access. And when it comes to brushing and flossing, they often receive second-rate care. Of course, you can always improve. In contrast, it may be that the tooth's circumstances cause special challenges. For example, maybe the tooth-gum relationship forms a space that's hard or even impossible to clean. Or maybe the tooth's alignment is reasonable but still irregular enough that food and debris tend to trap. Situations like these may result in aspects of the tooth that are predisposed to persistent dental plaque accumulation. And if so, recurrent decay, meaning the formation of a new bout of decay after a previous cavity has been repaired, may seem a likely scenario to your dentist and therefore tip the scales in favor of them recommending tooth extraction. Exactly what process will be needed to fix your tooth will also need to be weighed. For example, is it even possible for your dentist to make a successful repair? After all, teeth that are hard for a person to reach when cleaning can be a challenge for their dentist to access too. If the needed dental work is extensive and expensive, does the current or potential value of the tooth warrant this level of care? Additionally, wisdom teeth sometimes have aberrant anatomy. And that can make the outcome of some procedures, like root canal treatment if needed, less predictable. So, clearly, your dentist will have a lot of treatment issues to consider before advising you one way or the other. In passing, we'll mention that for small cavities the cost of placing a filling versus extracting the tooth will probably be fairly similar. That's because the cost of pulling an erupted wisdom tooth, meaning one that has come through the gums into fairly normal positioning, shouldn't be any more than any other tooth. For more details, look for our website's pages that discuss fees for both fillings and extractions. Beyond all that we've discussed, there is, of course, the issue of what you personally prefer to have done. If a decayed wisdom tooth has debatable importance and a questionable long-term outlook, you may want to be done with it once and for all. However, if you lean toward this option despite your dentist's encouragement to the contrary, it'd be smart to let them run through their arguments again because once your tooth is gone, it's gone forever. With that advice, we'll wrap things up. Don't overlook reading this video's associated webpage for more details and more thorough arguments on both sides of this issue. And good luck in making your decision and having your procedure. Goodbye.